It's such an honor to be joined by such esteemed co-panelists. Thank you for including me in this conversation. I think one of the most profound transitions that has occurred within the 2023 calendar year is the realization among all governments in the world and most people in the world that we have crossed an inflection point with the use of artificial intelligences. And while many parties have been anticipating such transitions and theorizing about when precisely they might occur, uh, what had not happened prior to this year is something that all humans could easily recognize as engagement with an artificial intelligence that passed what was originally thought of as the Turing test, where it was no longer obvious and straightforward to tell whether you were interacting with an artificial intelligence or a natural intelligence. And while those implications were long forecasted, they hit our society very hard and very quickly. So it's been remarkable as a person who has been focused on applying blockchain and Web3 as the governance and guardrails and control mechanics for a future of AI that humanity could trust for more than 5 years. It's been incredible to witness governments and corporations and every sector of our society working together to determine now how to make this incredible potential for humanity actually trustworthy. And then as recently as this past week, focusing in on the United States market, the Biden administration issued a groundbreaking executive order, trusted AI. And then our Office of Management and Budget in the U.S. federal government issued further very, very clear directives on the implementation of the executive order only 3 or 4 business days ago. And the concreteness and the breadth of the scope is remarkable to see. And this is followed by, back in March of 2023, in the United States, the National Strategy to Advance Privacy-Preserving Data Sharing and Analytics. This was published by an organization in the White House, very consistent with the overall aims. So as we look together, I'm sure in this conversation about themes from the executive order, such as protecting Americans' privacy and standing up for consumers and patients, we're at an incredible inflection point together. And Yamina, I love what you had to say about the need for collaboration and accommodating an accelerating rate of change. Something that I have thought about for many years is this divide between the rate of change in human institutions and bureaucracies, which is effectively static for all intents and purposes, and the exponentially accelerating rate of change in emerging technologies, especially when you consider that those technologies are themselves converging. So it is, you highlight a very important change in the mindset of natural intelligences, we human beings, where we must embrace approaches that will allow our systems of governance, of control, of oversight, of bioethical risk management to evolve somewhere close to the pace of the technologies that are affecting humanity. I have been facing any number of barriers and challenges over 2023. It's certainly an honor to be able to discuss some of them. We have been focused on implementing multi-party networks that can facilitate care coordination across organizational boundaries for research and clinical medicine without exposing or centralizing the data estates of the participating enterprises. This is a vital element for achieving ecosystem level trusted and verifiable insights, and especially for the potentials of collaborative machine learning in a new and trusted modality, as well as the what we purport to be a more compliant and ethical use of trained AI models among those stakeholders. So we have a multi-party network solution called Data Integrity and Learning Networks, and that is a key technology that enables that to function is a next generation solution for consent called Fireblocks. Fireblocks is FHIR, Fast Healthcare Interoperability Resources. It is an important mechanic that extends the spirit and intent of the anti-information blocking provisions in the U.S. law, the 21st Century Cures Act. That act mandates that an entity covered by our primary healthcare privacy law, HIPAA, is required to expose a gateway for API access using this standard FHIR. And our consent solution is intended to extend those FHIR servers that are required by regulations to be exposed by all HIPAA-covered entities in the United States. Now, this sounds like such a terrific idea, doesn't it, right? So what could possibly go wrong? Why isn't this being used everywhere right now in the United States? I'll be happy to unpack some of the reasons. One challenge that we've had is that while Equidium Health and our partners and stakeholders believe that the secondary use of health information that is a common practice for training to be commercialized AI models is a decreasingly legal and questionably moral practice. And while the individual transactions involved with brokering all kinds of usually de-identified health information are technically discretely legal today, we believe those transactions, when combined, produce an effect that harms the dignity, agency, and privacy of the human beings whose information is being custodied by trusted actors in the healthcare ecosystem. Well, those actors in the healthcare ecosystem don't necessarily believe that their secondary uses of health information is incorrect, and they believe that it is in fact compliant. And it may well be in this moment. So a major challenge is creating a new mindset around what do we think of as the actual nature of personal data. Our perspective is that it is now inseparable from personhood and should be treated as such, and that other bodies of law beyond property law should be applied, such as labor law. But this all represents legal, social, economic, and cultural change that is challenging to undertake. At a practical level, this enables an enterprise custodian of health or personal data to be able to have fully identified and granular control granted to the data subject. Those consents, instead of being PDF paperwork, become micropolicies implemented at the data layer, verifiable, auditable, enforceable, and those granular consents become dynamic and modifiable. These are all vital factors in the EU AI Act, the GDPR prior to that, and now with the US AI executive order. I think it's abundantly clear that the time is now to do this. Hopefully, what will happen in the coming year is that there will be more of a consensus position among healthcare and healthcare ecosystem actors about what an appropriate secondary uses of health information really entail. Thank you, Ingrid. I really like this challenge. Thou shalt not say AI.
Mm-hmm. Yeah,
I will take up this challenge. So I'd like to break my thoughts about 2024 into 4 categories. What is going to occur in the community of payers and providers in the public and private sector? What's going to happen with the individual? What's going to happen with the parties seeking to procure data and AI services and assets, pharma, med device, all public sector research sponsors? And of course, what about all of the other consumer-facing businesses that custody personal data that might be highly impactful for social determinants of health, retail, consumer goods, etc.? So the key is that all four of these stakeholder categories are going to be increasingly viewed as data ecosystems that have various characteristics and qualities that can lead to value or risk for the constituents and stakeholders that they seek to serve. So first, on the public and private sector payer and provider side, I predict there will be an increasing realization that the value of their own enterprise data estates is not going to lead them to the kinds of insights and innovations that they are seeking to drive. And instead, it will require collaborative computing with advanced privacy technologies across other actors in the ecosystem. Key advanced privacy technologies include, of course, blockchain as a base layer, but advanced privacy enhancing technologies lead to extraordinary optionality in achieving compliant workflows. This includes things like trusted execution environments in the cloud and at the edge, zero knowledge cryptography, and other kinds of verification and attestation objects that can enable trust to be distributed among the ecosystem without centralizing and exposing data. On the individual side, what I believe is going to happen is by the time we are at this point next year, many more people in the general population around the world will understand that the personal and health information about them that is scattered and fragmented throughout every part of our digital economy is in fact of extreme value to them, not necessarily strictly financial value, but that value to achieve their health and their prosperity and to care for their family and their children and their elders. This importance is going to lead to an increased demand for agency, dignity, and empowerment with respect to the information about them custodied everywhere throughout our modern economy. From the data and AI purchaser perspective, so this is pharma, device, in public sector research sponsors all over the world. These organizations are increasingly, as Yamina and others have mentioned on this remarkable panel, by the way, thanks everyone, is that in silico research is going to explode in its potential. And what that means is that this idea of every enterprise being able to create its own digital twins about others is a silly proposition. The only party who can create a digital twin of massively predictive power is the data subject themselves, empowered to aggregate, curate, monetize more information about themselves than any individual ever could. The potential of self-sovereign digital twins will be the breakthrough revolution that will allow in silico research to explode from its already white-hot status. And then finally, for the consumer-facing businesses that are buying market research data in volume and continuously trying to better understand customers and better engage their constituents, these organizations will now have the opportunity to choose to contribute to these kinds of in silico research endeavors that will improve the prosperity of their communities and aid in the economic and medical and social advancements of their valued customers and stakeholders. So all of those things are going to come together and start to be seen as data ecosystems, and it's going to be one heck of a 2024.